others will join us as we go. Okay, we are recording this presentation for people to view later. Reminders, place questions in the chat. Becky Wiseman, will be moderating the Q&A. Be sure to mute your audio so that we don't have a lot of background noise and feedback. You must complete the CE evaluation form following the workshop, and you'll get a link to receive credit for the continuing education. And the PowerPoints and recordings will be posted to the Maryland Nursing Workforce Center website following the event. And they will also be on the NSP2 website. You want to go to the next one?
Just the title.
Okay, so our program today is overview of the next generation questions. Our presenter is Dr. Desiree Hensel, who currently is residing in Vermont. We're happy to have her here visiting with us today. We could go to the next slide. The disclosures, we always share the disclosures as it's part of the ANCC accreditation. This educational event has no relevant financial relationships within eligible companies to disclose. None of the planners or speakers for this educational activity have relevant financial relationships to disclose within eligible companies whose primary business is producing, marketing, selling, or distributing healthcare products used by or on patients. The University of Maryland School of Nursing is accredited with distinction as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. So I think that's it, Desiree, and you will get 1.5 contact hours for attending. To receive the CE, you have to complete the evaluation, and then you will get your certificate via email for you to print out or to download and save in a file. About 2 to 4 weeks. I usually got mine about 2 weeks, so it's not a long time frame. Okay, next.
And it's just
and
me.
You're ready.
I'm ready to
I'm
go.
going on mute. Okay.
Well, I want to thank the University of Maryland and the Nursing Workforce Development Center for inviting me to talk today about this so important topic of next generation NCLEX. And I want to thank all of you for taking time out of your very busy days to learn more about the topic and to take this journey with me. A little bit about myself. I was faculty at Indiana University for many years. I relocated out east and was Dean of Curry College School of Nursing in Milton, Massachusetts up until May, where I stepped down and I'm working as a private consultant right now. So I am by background a pediatric clinical nurse specialist. So if it seems like you see a lot of pediatric questions in these slides, please just bear with me. Okay, our learning objectives for today. We are in this session, you're going to review the 7 next generation item types and consider their use in testing in each step of the clinical judgment model. And we're going to include information on scoring each type, which is a little bit challenging. After engaging in this session, you're going to be able to choose the appropriate test item type to measure a particular step of the clinical judgment model, and you're going to calculate the score for each type. Okay, so this is not new information. If you've been a part of these series all along, you know what next generation NCLEX is about, but basically it started as a project to assess higher order construct of clinical judgment, to find a different way to test it. And it began with this literature search by Moonteen in 2012 that found that about 65% of all errors could have been prevented if we had better decision making. And this led to the creation of the model for testing clinical judgment, first published in 2016 and has been revised 3 times or 2 times since, so 3 different iterations of it. They began pilot testing in the new item types in July of 2017. They revised that model, the original model from 2016 in 2019 to show the nursing process. And what we know is that full implementation of next generation NCLEX is anticipated for April 2023, and they are on target to roll that out then. This is the most current iteration of the clinical judgment measurement model. When it first came out in 2016, there were only 4 aspects in layer 3, and it was not aligned with the nursing process. That alignment was added in the 3rd iteration in 2019, and is the most current model. I have to tell the story. Anybody who's been with me before may have heard me talk about it, but the first time that I actually was exposed to this model was in Cape Town at Sigma Theta Tau International at the Research Congress in 2016, where they placed myself and Phil Dickinson in the same breakout room to do our presentation. And he and Dr. Wu basically started talking about their findings from researching the clinical judgment model that they were doing. And then I gave my presentation about visual thinking strategies. After it was all over, I really didn't know much about him and didn't know who he was, but he came up to me and he's like, don't you really think that when you're teaching that, you should be teaching people that you are telling them how to analyze? Don't you think you should include those words? And I kept thinking, gosh, this is kind of pushy. But then I got to understand it, and it's because what I was doing really fed into his model and of teaching people how to analyze, look at patterns. So anyway, that was my first experience with the clinical judgment model. If you have been following the rollout, there have been some changes to what we think the test plan is going to look like. At the mid-year meeting, they made a general announcement about the fact that we know the test plan is going to be the same for the RN and PN, and the test length was going to be 85 minimum questions to 150 maximum question, with 15 unscored items in the first 85 items. We know the first graded questions are going to have 6 cases. I mean, not 6 cases, we're going to have 3 cases, each with 6 items. So they're going to be a total of 18 questions based on 3 cases. And then there are going to be 52 standalone items. What is different than what they said at the mid-year conference is how they are defining standalone items. At that mid-year, the conference that they had in March, they made it indicated that you wouldn't be seeing the standalone trend bow ties really until after 85, and they've come back now and they said no, they can really appear in those first 85 questions. The problem with saying if they appear in the first 85 questions, they're practice questions and they're not going to be graded, is then nobody might take them seriously, and we don't want to point out to students which questions will be graded and which won't. By the same token, we know there are 3 graded cases, but some students could get up to 5 cases because it's part of the 15 questions that are unscored. So if I made that clearer or less clear, I'm not certain, but the point is there will definitely, everyone's going to get a minimum of 3 cases with 6 questions each, but they could get more. After 85 questions, they are still very clear though, there will not be cases. There are standalone, there can be standalone NGN items, but they cannot be cases because we know after 85, the test can shut off at any point and cases have to be 6 questions. We know that the test will be 5 hours and it is anticipated to start in April of 2023, but beta testing with practice exams for people will be available, will be available in 2022. So coming out of the NCLEX conference in September, we kind of have a different view of what we consider a standalone item. We have standalone items are meant that they can be used for a single question. That's what we mean by standalone item. Right now, we have standalone traditional items, which are used to test knowledge of the client needs. And what we have are the multiple choice, the select all that apply, the ordered response where you drop and drag and put things in the order you would do them, fill in the blank, graphic, and exhibit. Those questions are anticipated that they will persist into the new test plan and again be used to test client needs. What is being added are the new item types that we are going to go into great detail today. When they originally started talking about these new item types, there was a question of whether or not these new item types would only be used in cases or if they could be used to test client need categories as standalone items. And what they said at the NCLEX conference in September is these item types are meant to be used throughout the exam, so they could possibly exist outside the cases. So we'll get into that in a little bit more as we go along. The final item types are these clinical judgment standalone item types, the bow tie and the trends. And I have 3 workshops planned. The last one, we're going to go into great detail about them. The bow tie is a specific item type, which is a drop and drag that there are always 5 answers for. A trend item can be any of the other item types that you're seeing for NGN except for the bow tie, but it's meant to look at things over time. So again, there'll be more on those in the final workshop that I did. Now, of all those standalone item types that I just showed you, what we know is case studies will only use 13 item types. They are the new item types with one exception. They're pulling over multiple choice. Guess what? You can still use a multiple choice question. So that is actually good news. And we'll talk about when the most appropriate times are to use those. The other 12 item types are going to feel newer to you. And we'll get into those right now. So before I just go through the 13 different item types, I just want to talk a little bit about case writing rules. Some of you may have attended the workshop Wednesday on case writing. I know that you were going to go over how to use that with a template. I just want to say some general rules is that remember that these are context-based, scenario-based, and there are always 6 questions associated with a case, and they always appear in order. They will always be the first questions recognized cues. This next one will be analyze cues. The next question will be prioritize a hypothesis. The 4th question will always be generate solutions. The 5th question is going to be take actions. And the 6th question is going to be evaluate outcomes. I have had faculty in workshops ask me about blooms. You know, they'll tell me, well, in our program, we have it set up that we set up so many analyze questions and so many apply questions for different levels of exams. And how do you recommend me to go forward in this way? And what I really want to tell you is that the clinical judgment model is a cognitive framework in and of itself, and you really need to focus more on asking the level for the cognitive task at hand than worrying how it fits in Bloom's taxonomy. There is sort of a natural alignment that I'm showing with this chart, but if you focus on trying to ask the right question, you're going to be doing the right thing. There are 3 scoring rules in the new NGN. The first scoring rule is the plus minus rule. It is used whenever students can pick unlimited options for a question. The possible points that that question is worth are the number of items that are keyed correctly. In a question like this, students get 1 point for every time they pick a correct option, but every time they pick an incorrect option, they get a minus point. And this is done to prevent students from gaming the system. If they found out in a select all apply question that if you go through and you select every single answer, there's no penalty for selecting something wrong, then they would always pick every question so that they could definitely cover everything. So that's why that's there. It's to prevent the gaming. So here is an example of something that would be a select all that apply question. Which items are viruses? And you can see here I have 3 items that are supposed to be keyed correctly, but this student has selected 4 items. So I'm going to give them 3 points for what they got correct, but this one they got wrong. I'm going to subtract a point, and so they would only get 2 points for this question. This differs significantly than how we are scoring right now in NCLEX because everything is either all right or all wrong. The next rule is the 0-1 rule. It's a little bit more like kind of what we are looking at today. However, it is still in questions that have multiple answers. They get 1 point for every answer they select correctly. The minimum score is always 0, and I wanted to point that out for the other one. We don't ever negative score. The worst you can be is 0. We're not going to go less than that. The possible points are the number of keyed items. So I just took the question that you saw and I changed it slightly, and I'm going to tell the student how many answers to pick. So which 3 items are viruses? Because I have told them how many items to pick, I'm going to only count the ones that are correct without subtracting the ones that are wrong. So here it's the student. I still have the 3 things that are correct. They picked 2 correct, the influenza and hepatitis B. They picked 1 incorrect, but in this rule, I don't subtract it. I only count what's right. So there they get 2 points. And if you thought those rules were confusing, we can go into Rationale, which is the most challenging of the scoring rules. A Rationale rule is used when questions have a linked response, and I like to call it a cause effect. When you have to know one part of the question to really get the second part right. They are always one sentence, so there are 2 parts of a sentence. You can have a dyad, so it's basically 1 cause and 1 effect. And if you have that, then both parts have to be right or you get no credit. If triad has 1 cause but 2 effects, those are worth 2 points and you can get partial credit for those. The way that they pan out, here is an example of dyad scoring. I've got complete the sentence from the list of drop downs. To prevent night blindness, the nurse would recommend carrots because they are rich in vitamin A. So I've got the cause right and the effect right. So in this question, dyads are only worth 1 point. They would get the 1 point. If they get any other combo, pick any other combo, they get 0 points for this question. The triad scoring is a lot more challenging. I do have to get everything correct to get 2 points. But if I have two effects, I can give partial credit if I get the cause right and 1 effect. If I get the cause right and 1 effect, they're going to give them 1 point. If I don't get the cause right, the first part right, you don't get any points. And if I don't get at least 1 of the second part right, the effects, I don't get any points. Now, these are difficult to score, point blank, and they may be very difficult to replicate in your LMS system or however you're delivering your testing. So I can tell you we'll get to drop downs as we go through the presentation. They're going to be a little bit easier for some systems to score than the drop and drags, and we'll talk about why in just a little bit. Before I move on, are there any questions about scoring? Okay. All right.
Yeah,
Well,
I'm not seeing anything in chat at the moment.
well, that's great. Okay. Well, then let's move on. Okay, general writing rules. Remember, just the same basic good test writing principles that you've always used. All options need to be plausible. Options should be in similar length and format. Our leading questions are going to always end in a period. We're going to avoid negatively worded questions. You don't want those absolute terms, the always and never, because what in nursing is always and never. Use plain English as much as possible, words that most people will understand. Avoid using terms that are known only to the dominant culture. You know, my example of that would be Cheerios. I'm a pediatric nurse, and I can't tell you how many questions in my lifetime I've written about what is a good finger food, Cheerios. Well, if you're not from the United States, you probably don't have a good idea what Cheerios are. And then remember, they will continue to bold keywords like most or least. Okay, let's go through the case study item types. Our old friend is still here, multiple choice. They still look the same. They have 4 options. Only one answer is correct. They will be indicated with a radio button in front of them in NGN. That doesn't mean that's the way you have to do it, but that's the way they do it, because the radio option button will only allow you to pick one selection at a time. And if you pick something else, it will automatically unselect the prior selection. They are worth 1 point, and they are scored as 0-1. Okay, so that is, I don't think yes, here is our example. We have our case study that are always going to be on the left. Our question is always going to be on the right. And here I am asking which factors best explain the client's finding. And you can see I have 4 options. In this case, the student did not select the correct option, so they would get 0 points for this question.
Diane, I have, Desiree, I'm sorry. Excuse me, Desiree. I have a question in the chat about the dyad and the triads.
Mm-hmm.
Are the answer options given, or are they fill in the blank, or are the options given?
Thank you so much for asking. We're going to come down to that in a little bit. There are 2 ways that these can happen. One is through a drop down, and one is through a drop and drag. So those rationale questions will appear in both formats, and I'll show you the both in great detail. But thank you for asking. Okay. Okay, so select all that apply. The difference between this and the ones we're using now is, remember, select all that apply and in 6 options. Well, you can go up to 10 now. One has to be correct, but they're still saying all could be correct. You indicate these with a box. This doesn't mean that necessarily you have to do it this way, but this is the way that NGN will do it. When boxes are in front of them, that means you can pick as many options as you want, unlike the radio dial, which will automatically unselect something if you pick a different option. They are worth 1 point per correct response. The NGN scoring is plus or minus. And remember, we're not going to negative score anything. So in the example I have over here, I've got the nurse reassesses the client after implementing the treatment protocol and giving a second uterotonic agent. I want to bring your attention to the fact that I have started the lead-in process. And when they start the lead-in process, they put an arrow in front of it. New information can appear above the lead-in, but the lead-in is going to be indicated with an arrow that actually shows the student what they need to answer. So which findings indicate that the client status is declining? This is a select all that apply. I have 1, 2, 3, 4 options checked as correct. So this is worth 1 point. The student got the first one. They got the second one. They got the third one, but then they picked 2 questions that were incorrect. So I'm going to give them 3 points for everything they got right. And then I'm going to take away 2 points for everything they got wrong, and they get 1 point for this question. Okay, so now you try. I have a question over here. Which client findings need immediate follow-up? Select all that apply. I have 2 options that are correct. And then I have the student has selected 1 incorrect option and 1 correct option. So in your own mind, how many points was this worth? And what should we score the question? And if you said it was 2 points, but they get 0 points because they selected one response that was right and one was wrong, you've got that right. Multiple response select N feel like my new best friend because they're somewhere between the two. They're not as hard as a select all that apply because I'm telling you how many, but they're not as easy as a multiple choice question. So they seem to be this nice happy medium to go down that road. You're going to format them the same way that you would do a select all that apply. They're going to have 5 to 10 options. You're going to indicate, well, NGN will indicate it with a box. You can select less but not more in these. So NGN has an automatic stop response that students would not be able to select more than the options that they are being told to select. Now I'm going to tell you, the system that I was in, we were using Canvas for our testing platform. We had no way to automatically stop students. If we told them to pick 5 items, they could still pick 6, and it would just count against them. So that will be something that has to be worked out as you learn more about your testing platform. You're going to get 1 correct point for every correct response, and there's 0, 1 scoring. So over here, I have the same question, but again, I've changed it to be tell them to select the 4 findings because I have 4 correct options for this particular question. So in this case, the student got the first one right, the second one right, and the third one right, but they select 1 incorrect option and didn't select 1 correct option. So no negative penalty, they just get the 3 points for the 3 correct options that they selected.
Desiree, we have a question. Is there an LMS system that you are aware of that can handle this type of grading? Have you seen one?
I am not aware of one yet. I know that they are working on it. I believe ExamSoft is getting close to it, but I cannot tell you for sure that it is. Now, at the very end, we're going to talk about some implementation considerations, and maybe I should just bring this out right now. I'm going to tell you how NGN is scoring these, okay, how the National Council is, but there's also a disclosure that they're telling you questions are scaled. So, but they're not going to tell you, share how they scale questions. This item, even though it would be worth these many points, is still only 1 question in their system. So what's really important is you're going to have to come up with a scoring system that makes sense for your institution. And we'll talk about that a little bit more in the end. I want you to know how they're doing it, but that may not be exactly how you end up implementing it. And I think that that's okay, because the students don't know exactly how it got scored anyway. Okay, so here we go to a question. Which 2 client findings need immediate follow-up? And so I've got, so how many points possible? And what would the student's score be? And if you said it's a 2-point question and they got 1 point, you would be correct. Okay, so those are the most familiar item types. They are just really a variation of things that we're already doing. So from there, we're going to go into the more challenging, what are really the technology enhanced item types. The first one is called a matrix multiple choice. You write them by having 4 to 10 rows, and each of the columns that are in the matrix will have 2 to 3 options. They're marked with a radio dial because you can only have 1 option right in a row. Each row will only have 1 correct response. The students need to pick 1 in each row before they move on. We're going to treat each row like a multiple choice question, and they get 1 point per row is possible. Maximum number of points would be the rows. So here is an example. For each assessment, click to specify, and that's the term they like to use, click to specify. If the finding indicates that the interventions for preeclampsia have been effective, ineffective, or unrelated to treatment. And you can see here, I'm telling them the column titles that I've picked. I'll go down the assessment findings, and then I have to go and decide, and this would be after reading the case, if it shows that what I gave was effective, ineffective, or unrelated. So this is set up correctly. I've got, I can have 8 to 10 rows, and I can have up to 3 columns. This one would not be set up correctly because you got to have at least 4 rows. So there's not enough to this one. Okay, so the way to score it is to go down each row and did they get it right or not? I have 8 rows here, so this would be considered an 8-point question. And I'll go down each row. This row is right, so they get a point. This row is wrong, so they would not get a point. This row is wrong, no point. This row is right, and so forth. So in this particular question, they got 5 of the rows correct, so they would get 5 of the 8 points. So what can you have as columns? You can have 3 columns. You can have effective, ineffective, unrelated, improved, declined, unchanged. Examples of 2 columns. If you did teaching and then you wanted to know whether it was effective or ineffective, you could say, was there understanding or no understanding? Or you could say, was the teaching effective or ineffective? That would be okay. Are the findings helpful or not helpful? Are they anticipated, or orders anticipated or not anticipated? Would an intervention be indicated or not indicated? Would it be essential or contraindicated? Is something a risk factor or not a risk factor? Those will all be things that might be possible columns. If you have been following NGN for a while, you're going to see that there were examples out there where they had 3 categories where that they had an intervention was indicated, it had a soft category: essential, non-essential, and contraindicated. Okay. They have come, the National Council's kind of changed their philosophy on that. And what they're saying is this non-essential category, this soft category, really doesn't test well. So you're going to see that in newer versions that they're kind of discouraging that soft category because it's not something that moves the client forward, but it doesn't necessarily hurt the client. And that's not, it's just really kind of, you get the experts all in a room together and they debate what the validity of that particular column. So you're not going to see as many of those moving forward as you would have seen in some of the beginning examples for NGN. Okay, so here is my case. For each possible intervention, click to specify if the intervention is essential or contraindicated. So I have my possible interventions over here. Look through this and think, how many points is this worth? And what is the score? And if you came up with 4 points for 4 rows and 3 points because they got 3 right and 1 wrong, you would be correct. Okay, so that is the matrix multiple choice. Another group is the multiple response grouping. They're really a multiple response question, but we've broken it down into different categories for the student to answer. They're kind of written as a table with a minimum of 2 groupings and a maximum of 5 groupings. Within each group, you can have 2 to 4 options. One of the things to think about when you're writing these is that all groups should have the same number of options. And there has to be at least 1 option correct in each group, but there can be more. Because they can select an unlimited number of options, this is going to be scored as a plus minus kind of scoring rule, but we're going to score per group. And that's a little bit confusing, and I'll show you what I mean. And you cannot negative score per group. The maximum correct is the number of keys. So here is an example. I have 3 categories here. I've got activities, medications, and monitoring. I've got potential orders. In each case, I've got 3 potential orders. So I've told the students to select the anticipated provider orders from each of the following categories. Each category may have more than 1 potential order. So I'm telling them that they can pick more than 1. There is also a disclaimer at the bottom that says each category must have at least 1 response, so that we're not leaving students out in limbo. So this is set up correctly. You know, I've got at least 2 groups, but no more than 5. So I've got, and each group has the same number of options in it, which can be 2 to 4. And I've got all the disclosures that I need to have. This one would not be set up correctly because I have one group that's got 5 questions in it, 5 options in it. So when I tell you we score by column, what I'm going to tell you is you get a total for by group. You're going to get a total for group 1, you're going to get a total for group 2, and then you're going to get a total for group 3. And since there's no negative scoring, let me just go through these. So let's start with, how many points do you think this is worth? And if you said 6 points, it's correct. But let me go through the scoring in great detail. So in the first one, they picked everything. Because it's plus minus, they're going to get 2 points correct for the 2 that they got right in that group, but we're going to subtract the one that they got wrong in that group. So group 1, they get 1 point. Group 2, they selected 1 correct and nothing else. So they'll get 1 for group 2. Group 3, they selected 1 correct or 1 incorrect, and they didn't select the correct ones. So there's no negative scoring. The worst they can do is 0. So they get 0 for that group. So I'm going to add together all the group totals, and they're going to get 2 points for this question, this particular questions. The idea behind the grouping is to try to break it down a little bit for the students, to make it a little bit fairer for them in some of these multiple choice questions. Okay. Any questions on that one before we go on? Because I think that this one's kind of tricky. Oh. Okay.
No questions. I had an earlier question back when we were looking at 3 columns. They want to know, if do you always have to have 3 columns? Can you have just 2 columns? And I think it goes with the rules, and it was several back. So
let me go back and I'll just show you the rules again, and we'll come back. Yes, you can just have 2 columns. Helpful, not helpful. That's 2 columns. Anticipated, not anticipated. 2 columns. So the most you can have is 3, but you can definitely, 2 columns is definitely okay.
Okay, thank you.
Okay. Okay. Okay, so going on, the matrix multiple response. So we've gone through one form of a multiple response where they could only pick 1 item per row. Matrix multiple response, they can pick multiple items in the row. There can be between 2 to 10 columns and 4 to 7 rows. Now, I don't know who on earth would want to come up with 10 columns. That seems like an awful lot to me. You know, and generally when I write these questions, I write 3 to 4 columns. But it is an option to go that much. We showed you how grouping, you're going to score by groups. This one's going to be scored by columns. So before, when we did the multiple choice, they were matrix, they were scored by rows. Multiple matrix multiple response are scored up and down by columns. What that means, though, is that there has to be at least 1 correct response in a column, but there can be more. In this particular item type, it is possible to have a row where there are no options correct because we're scoring by column. However, I kind of discourage you from doing that because I think it's kind of tricks the students, but it is possible. Okay. It is marked with boxes. And again, we're going to go back to the total points is how many correct keys there are for the item, but we have no negative scoring per column. So this particular item is set up correctly. I've got for each finding, click to indicate if the symptoms are consistent with alcohol, amphetamine, or opioid overdose. Each finding may support more than one type of overdose. And then I've come down and at the bottom got this disclaimer. Each column must have at least one response. I have 3 different columns here, and I've got 4 different findings. So this one is set up correctly. This one is not, for a couple reasons. One is I don't have all the disclaimers that tell students how many that they have to pick something in each column and that they could pick more than one. Each finding might be support more than one kind of overdose. I also have too many rows for this one. So we are going to score by column. Let's see how you do with this one, and then we'll come back and talk about it. How many points do you think this is worth? And what do you think the student's score is? Give me a second. Okay, so we have 8 items keyed correctly. So this item is worth 8 points. And we'll start with column 1. They picked 3 items that were correct in column 1, but then they picked 1 item that was incorrect. And I am going to tell you, I just apologize to you because I made a mistake here. So the incorrect one should be subtracted and it should be 2. So I do apologize. I will correct this. Make a note in your slides. The second column, they picked 1 correct and 1 incorrect. And so they get 0 for that column because we'll give them 1 point for the correct, but 1 subtract the incorrect. The last one, they picked 2 correct and no incorrect, so they will get 2 columns for that. So I did make an error on the first one. I do apologize. So the total answer is 4. Okay. Okay. Drag and drop close. We are used to doing some drag and drop questions right now. And the way that we do drag and drop is an ordered response. You know, the question will be put the items in the correct order. You know, the nurse walks into the room and the room's on fire, and then there'll be the race steps, and you have to order them. What is first, what is second, what is third, and what's fourth. So students have been doing drag and drop. Drag and drop have 2 different formats in the cases. They can be a close, and a close is the term that means complete the sentence, or they can be a rationale. So we'll start with the close. You're going to write a sentence that has a blank in it, and that is considered to be the target. A token is your list of word choices or your options. When you write a drag and drop close, there is a minimum of 1 sentence, but you can have up to 5 sentences or up to 5 blanks within the same question. So the point total will be between 1 and 5. Every blank is a every blank that you have is a point, and these are scored plus 1, 0 scoring. They're either right or the wrong. Okay, so the tokens or the list of options need to be at least 4 and up to 10. So here is an example. I've got two different questions, two different sentences in my question. IV dextran carries a high risk of blank. To prepare for the infusion, the nurse should blank. So my word choices are listed below, and I will drag them up to fill in the blank. The second side is showing you how it would not be correct because I need to have at least 4 word choices. So here is a question for you. The nurse prepares to give IV dextran. Drag the words from the choices, word choices below to fill in the blanks of the following sentence. IV dextran carries a high risk of, the first one is correct. Then to prepare for the infusion, the nurse should, and that option is incorrect. So how many points is it worth, and how many points would we score the student? And if you said that it is a 2-point question because we have 2 blanks and they get 1 point for the correct question, then you scored this one correctly. So we're going to take that drag and drop format, and we're going to offer another way to do it, and that's that rationale question that we showed you in the beginning. A rationale is only one sentence, and it has linked responses that you have to show knowledge of knowing the first part to get the second part correct. We can have these as again, one cause and one effect, which is a dyad, or one cause and 2 effects. It could be written something like, to prevent X, the nurse should do Y, or Y and Z. The client has something evidenced by Y and Z. The client is at most risk for X due to Y and or Z. Kind of is the way that they work out. When you do these rationale, how they're going to differ a little bit than the rationale, the drop and drag that we just did, is we only had 1 box of word choices. When we set it up to do a rationale question, we're going to make 2 groups of word choices, so 2 different boxes. We went through the scoring rules before, but I'm going to go into detail again as we go through the questions. So here is a drag and drop rationale with a dyad. The client, I'm telling the student to drag 1 condition and 1 assessment to fill in each blank of the following sentence. Here, the client is at highest risk for blank, as evidenced by the client's blank. So we told them to do the 1 condition, they have to pick from here, and 1 assessment to fill it in. If I write it as a triad, the one at the other side, I'm telling them to drag the 1 condition and the 2 findings. So again, there are 2 different boxes of word choices. The dyad scoring, remember, they've got to get both correct. If they don't get both correct, they don't get any points. If they get both correct, then they get 1 point. If you we seem to be missing my triad scoring, but we did that in the beginning. So remember, if it's a triad scoring, go back to the other rules, that if you get 2 points, if they are all correct, if you get the rationale, if you get the cause right, but only 1 effect, it's 1 point. Any other combination, there are no points. So like the drag and drop questions, the drop down questions can appear in a close format. So that means complete the sentence. They are going to be written in a similar fashion. You can have a minimum of 1 sentence or a maximum of 5 sentences, each with drop down areas. drop downs have 3 to 5 options per drop down. But all drop downs should have the same number of options in them. Your total score is going to be the number of drop downs that you have available for the students to select. We are going to use the 0-1 scoring when we go through these. So when you have a drop down, the student is first going to see the term select appear. And then when they click on the select, it will open up for the options for them to select through. So this is set up the right way. I have 3 sentences for this particular drop down. So there would be worth 3 points. Once you click it, then the list is going to appear for the students to pick from. And you can see this one is set up correctly because all of my drop downs have the same number of options. If I look over to the setup on the right, I'll see it's not okay because there are a different number of options in the drop downs, and the second one has only 2 options. So remember, I need 3 to 5. I'm going to tell you that drop downs are my new favorite best friend because they only require you, they're like a multiple choice, but they only require you to have 3 options. And writing a 3-option question is easier than a 4-option question. So I just love these questions. Let's go through one and then I'll answer questions about the items. So complete the following sentence by choosing from the list of options. So how many points do you think this is worth? And what would the student's score be? It looks like they got the first one incorrect, the second one incorrect, and the last one correct. And if you said it's a 3-point question with 1 point for 1 correct response, then you would be correct. So what questions, I see there are questions in the chat. What can I answer?
Based on trying to keep up, let me find it. kind of hard to follow here. It was about wait a minute, I'm trying to find it. The drop and drag are all or nothing correct. This is considered a high risk scored question. That was the question.
Okay, so
then,
the drop and drag, okay, so there are 2 different, if it's a drop and drag close, it is scored per box. Every box that is right is okay. If it is a rationale question where it's 1 sentence with a cause and effect, then it is, if it's a dyad, it's all or nothing. If there's 1 cause and 1 effect, it's all or nothing. If it is a triad with 1 cause and 2 effects, it can have partial scoring. But you have to get the cause correct. If you get the cause correct and 1 effect right, then you can get 1 point. If you don't get the cause right, you get 0 points. If you don't get at least 1 of the effects right, you get 0 points. Okay.
I think that's the questions.
Okay. All right, so let's go on. Okay, so the drop-down rationale look just the same as the rationale we did before, and I'll go into the scoring. I know the slides are up to go back into the rationale scoring, but no, the rationale scoring is the same whether it's a drop down or a drop and drag. The drop downs are written as a sentence with 1 cause and 1 effect as a dyad, or 1 cause and 2 effect as a triad. All drop downs need either 3 to 5 options, and all drop downs should have the same number of options in them. So back to the scoring rules. This one would be set up correctly. A triad is with 3, a dyad is with 2. A dyad scoring, if both are correct, you get 1 point. If anything is incorrect, you get no points. The triad scoring, you can get partial credit. If everything is correct, you get 2 points. If you get the cause and one effect correct, you can get 1 point. Any other combination is worth 0 points. Okay, let's try to score this one. Complete the following sentence by choosing from the list of options. The priority intervention is for the client to, for this client is to restore volume incorrect to prevent the serious complication of tissue necrosis. How many points was it worth and what did the student get? And if you said it was worth 1 point, and 1 point, oh gosh, it was, sorry, this, I apologize once again that this should be worth 0 points because it is a cause and effect, and it is, they didn't get everything correct. Okay, and I will correct those slides before we put them up on the website. Drop-down table. A table with a drop-down options in different parts of the table. A minimum of 1 column and 3 rows, maximum of 5 rows and 4 columns. 1 drop-down per row. Each drop-down has 3 to 5 options. We're going to score these 0, 1, and it's the total points is the number of drop-downs. So there are 2 different ways to set up a table. Here is one way. I've selected over here some client problems and potential interventions. This is sort of set up as a care plan. When they expand the select, then they get the options that they can pick from. That is one way to set up a table. Another way is setting it up kind of like a medication sheet. Choose the most likely option for the missing information in the table by choosing from the list of options. I've got it set up with the select, and then once I click the select, it expands to my different options. Here I have 3 different options, drop downs. So this one would be worth 3 points. So here again is the table. How many points, and I just, would it be worth, and what would the student's score be? You can see we basically have 2 correct and 1 incorrect. So this would be a 3-point matrix, and they get 2 points for the correct options. The final item types are the highlighting. And there are a couple different ways to do highlighting. The first is a highlight text. This is the one that you're going to have seen the most examples from the National Council. It's when they select part of a text to determine what is critical. You can either select parts of a sentence, or easier to set up is actually to set entire rows. Possible responses are tokenized, meaning that they are available for selecting. And by tokenizing them, you don't have to worry about whether or not something might be counted as incorrect because the student added an and afterwards. So it's giving exact parts of phrases that students can select. These are treated like a multiple response select all that apply kind of question. Within a text, you can have up to 5 areas of text that they can highlight. And then candidates will select and unselect the text. This is a plus minus scoring rule. When they get 1 point for each part of the text they select correctly, and a negative 1 point for incorrect. There's no negative scoring, and the maximum amount is the keys possible. So what we'll first show is this statement that, you know, that if it's going to be from the nurse's notes or part of the EMR, the nurse cares for a client brought to the hospital, and I'm saying next to click to indicate the findings that indicate the client is ready for discharge. So here it first shows as plain text with the instructions. You can also, another way to set it up as entire rows for the client for the student to pick from. When I say it's tokenized, it's when they hover over it with their mouse, it will show in a color that it is selectable text. I have only put parentheses here to show you a way that I have tokenized it. Again, the way the National Council do it is you're going to hover over and it's going to change colors, and then you can click if you want to keep it. I have shown you that I have 1, 2, 3, 4, 5, 6, 7, 8 things that have been tokenized that are options for them to select. Of that, there are 1, 2, 3, 4, 5 that are correct. The client, then the student will go through and they will make their selections by clicking on it to indicate that that's what they want. The color will change to the bright yellow to show that it has been selected. So in this case, the student has selected 1, 2, 3, 4 correct items, and he has selected 1 incorrect item. So the 4 correct minus the 1 incorrect item would give them 3 points for this particular item.
Here's a question. Are these types of questions appearing in all questions not associated with the case studies? Please confirm.
What we were told at the NCLEX conference in September is that all new item types are meant to be used throughout the exams. I will not tell you empirically that they are going to be, but the intent is that moving forward, they could be.
I have another question. Are there recommendations on how many item types should appear on each exam? For example, we currently have a certain percentage of SATA alternative items on each exam, which increases with each semester.
So the answer is no, there is not. And the other part of that is we know that each student is going to get 3 case studies, but it does not mean every case study that they will be exposed to all item types. So no, there is not a recommendation out there for that, but there is a recommendation that students start doing case study. I mean, my recommendation would be students, you include case study types. When we talk about the implementation considerations, one of the things that I would suggest to you is I think it's important for you to start using case studies to test students. But if your LMS or however your testing platform isn't ready to do certain item types, go with the ones that you're ready to do and use the others as learning activities in class. Okay, anything else?
Not at this time.
Okay. Okay, so there's one more way that we can do these highlighting questions, and it's called a highlighting table. And this is selecting part of a row. The responses, again, are tokenized. You can have a maximum of 10 options, but these are set up in definitely 2 different columns, and the candidates can select and unselect options. You're going to score them the same as you would score the text with the plus minus rule, +1 for correct responses, -1 for incorrect responses with no negative total scores. So this is set up as a table. I'm going to click to indicate the findings that indicate the need for immediate intervention. So I've got on one side some systems, and then on the other side some findings. So this is set up right. I've got 2 columns with up to 5 rows, including the headers. So then they'll go through and they'll start clicking the findings. So the vital signs need to follow. They thought the vital signs needed follow-up, but really it was only the neuromuscular and the color. So in this particular question, they could have selected something from each row was tokenized. So I tokenized entire rows to make it easy for them. It would have been worth 2 points for the correct responses. They selected an incorrect response, so the student would have only gotten 1 point. Okay, so those are the item types. Questions before I go about to recommendations? Okay, none? Okay, recommendations for use. So I have a table for you about where do these certain item types fit best. In general, under recognizing cues, the very best item types are really to use the select all that apply or the select and the multiple response or a highlighting text or table. You're not going to want to use a rationale in those because all you're asking them to do is to identify something without making major conclusions. So those are the best kind of ones. Avoid the matrix, the rationale or close, and probably multiple choice because you're asking them to look for more than one thing. When it goes to analyzing cues, select all that apply or select N are great. These are a perfect place to put all those matrix questions, either the matrix select all that apply or the multiple choice. This is also a good place to put the rationale and close question, both drop and drag or drop down. In analyzing, you should avoid highlighting because you're asking them to connect patterns. When you highlight, you're just asking them to identify something in the text and you don't really have them connect a pattern. So this would be, I would avoid that for number 2. In a prioritized hypotheses question, you're asking them to come up with a top concern or a top priority need. This is a great place to stick in a multiple choice question. It is also a great place for a rationale or a close. Again, I would avoid the highlighting here. I would avoid a matrix because you're wanting them to come up with the one thing that they should do first, and avoid a multiple response. However, it is possible to do a multiple response select N, but not a select all that apply, because again, you're not looking for lots of possibilities in this particular question. Generate solutions are absolutely perfect for select all that apply or select N, and they're absolutely perfect for those multiple choice matrices where you're going to select multiple interventions. I would try to avoid, I've tried to write this up as a multiple response matrix where they have multiple selections per row. I haven't been able to figure that one out. I can do a multiple choice is perfect, but I have a really hard time trying to write it that way. Multiple choice is probably not the best here because if you look back to what is generate solutions, you're going to see they're looking for multiple possibilities, multiple things that the nurse might need to do. So it's probably not the best place to use a multiple choice question. Take action is pretty open to what kind of questions you can put here. It lends itself to a wide variety of questions. Here it's highlighting because you can ask what should the nurse do immediately if there are orders or something like that. And they can click to highlight that. There are lots of different things that you can do here. Evaluating outcomes works well to go back to highlighting text or table. So you have a nurse's note after all the interventions have been done, and you can click to highlight which findings show the interventions have been effective, or which findings still need further follow-up. Multiple choice matrix works well, show if the intervention has been effective or ineffective. Again, this is a good place for a select all that apply or select N. And this can also be a rationale. I would probably avoid the multiple response matrix again here. I just haven't been able to figure out this one. You could do a close. I would probably avoid it. These are general recommendations. They're not hard. You may be creative and to figure out some things that I haven't gone through, but this is kind of what I've gone through from experience from writing a lot of questions. Okay. So getting started. It's really important to get the lead in sentence correct. So for matrix questions, it's for each whatever finding, click to specify. So click to specify is the term that they like. If you're using a multiple response matrix, make sure to include the statement, each category may have more than one X. Highlighting, click to indicate. Drop down, complete the following sentence by choosing from the list of options. Drag and drop, which I dropped twice. Drag the word choices to fill in the blanks from the following sentence. Multiple response, select N. Select the finding, the number of findings, 2, 3, 5. Multiple response, select all, apply. Remember, it's select all, apply, and we're used to that one.
I have a question.
Okay.
Is the format you used here the way the questions will appear in the NCLEX RN exam?
Yes, basically. So meaning I would like to, if you're talking about the general format, questions are going to be on the right and the case will be on the left. The format that I am showing of how the questions are going to be set up with the lead in is what you should anticipate seeing.
Okay, I have another question. They want to know when the PowerPoint recordings will be available. And since you have to do some updates on the PowerPoint, it may be a week or so, right?
Well, and they were going to release that with the answers to the case study too. So I would say at least by next week. Yeah, sometime next week.
Thank you.
Sometime next week.
Thank you.
Okay, I just found that I had 2 errors. I apologize. I've been combining things and a lot of information, and I will make sure that those are corrected. I have a example.
I have a question, if I may. Excuse me. Do you know whether National Council State Board of Nursing will publish maybe a 25-question sample test for us academics to be able to use to just kind of prepare our students for, you know, what it's going to be like, almost like a mini type 25 point or 15 question?
So what I can tell you is I cannot speak for the National Council. I am not aware of this, but what I do know is that they plan to have beta testing available next year that students might have access to, but they have not come up with the rules for that yet.
Okay. Yeah, okay. No, that would be good, because I can see that we will have teacher-made test items, but it will be good to have exactly, you know, an example, an exemplar.
Well, but so let me clarify. What I can clarify is, you know how right now students do the tutorial that go through the different item types? That will be available to students in advance.
Oh, good.
Okay. Now they did say at the meeting this year that the tutorial would be forthcoming, probably in 2022 at some point in time, but that is not available to students now.
Okay, thank you.
Okay, I am going to stop sharing the screen and I'm going to pull up 2 screens. We have a brief activity and it's not going to take a long time. Let me stop sharing this screen and I'm going to bring up the 2 handouts that you were given. So, show all windows. Okay. I gave you a template to try to begin writing some questions on, and it has each of the 13 different questions, the best that I could come up with to help you start practicing writing some of these different options. They have the lead in sentence there, and then list the number of options that you can use your questions. And certainly, for instance, the first one, well, the multiple choice isn't a problem, but the second one, it's like the extended multiple response, select all, apply, delete, and any rows that you don't want to use after 6 or starting with 6. I've gone through with the multiple choice matrix, the grouping, the multiple response matrix, a drop and drag close, setting it up as a rationale, the drop downs, and then a drop down table, some examples, and some highlighting examples to help get you started. So let me stop sharing that one and go into our activity for today. Okay. So our activity for today is a changing Okay. We're going to go into groups, and we're only going to go in for about 10 minutes because we don't have a lot of time, but I have given you 3 different cases. One is a developing families breastfeeding case. One is a medical surgical adult with a UTI, and one is a mental health with a suspected overdose. When you get into your groups, what I want you to do is read the case. The case has for you 2 questions. It has 2 multiple choice question and a multiple response question. The multiple choice question reflects step 3, prioritize a hypothesis. The multiple response question represents step 4. On the right, I want you to see if you and your groups can change the question into another format. So you're going to change the multiple choice question into a drop down, and by seeing if you can add some options to it. And you're going to change the multiple response question into a matrix. So that's your instructions. And Sonia's going to break you into groups, and we'll just spend about 10 minutes on this activity. Any questions before you go? Okay, Sonia, can you, when you get into groups, remember you do have to hit join to groups, and if you are having any trouble, disable your pop-up blocker. And if for some reason you can't get into a group at all, just work on the activity on your own, and then we'll come back. Okay, so as you come back, I do understand that some people had difficulty opening up the case studies that were sent in advance, and so I do apologize for that. They are going to be available on the website with any, and all the answers will be available next week. Did anybody's group get through the case studies? So, I mean, get through the item changing?
Yes, we did.
Very good. What did you think about that?
First, after doing them, I came to the conclusion we are going to have to first educate our students and faculty as to the meanings of the testing items, the testing terminology.
Okay.
Because, you know, like when you do the columns and you say indicated versus anticipated versus essential, contraindicated, some we use frequently, some words we don't use. And in terms of trying to understand how to answer the question, that's going to be an issue. The other is there is a lot of technology in terms of how to select, how to drag, drop. So some of our less than computer savvy students are going to need practice just of how to choose, because they may not click, because I've had students complete items and not save at the bottom, not hit acknowledge. So in this, like if they're supposed to select, if they hover and don't click, they may not have selected, and you know, out of anxiety, they're moved on. And unless there is some built-in format where you didn't select anything or you only selected one, that might be an issue. Having said that, what I found with, for example, the first case, it's easy to take those 4 choices and put them into the first box.
Mm-hmm.
And then for the second one, evidence by, and then you would do descriptions. Or the interventions, you would do the same thing. You can move it over to the possible intervention, and then they would have to pick indicated, not indicated. It's pretty similar for the second one, except the terminology here was anticipated, not anticipated. For the third one was essential and contraindicated. So they have to understand that the questions are individual, so that they're not keeping indicated in their head when they're in the next question. They have to pay attention to what is that word, because for example, in the first one with the breastfeeding, it says request antibiotic prescription and is it indicated, not indicated. In the third case study where it says which interventions are essential, you need to understand one of the choices is administering naloxone. Is it essential or is it contraindicated?
That's such a good point, but it is, these columns are not standard. The columns
Right.
will change and the students are that's going to take practice. So that's one of the reasons we have
Right.
practice. So we are coming up on our time for today.
Okay.
What I can tell you is the session on the 5th, I hope you'll join us, because what we are going to do on that is we are going to use templates that have the 6 questions kind of selected, and we're going to go through writing entire cases and practice with that. So I hope you'll join me next on the 5th to work on that.
The question I do have though is, this is going to require, in terms of manpower and ability to build your systems. We currently do not use ExamSoft, but you would need software like that. I know ATI is moving towards that. I know UWorld has sent out feelers, you know, for setting up these formats and templates, because currently I think that's the challenge for people who want to get started in trying to move their tests over, is having to build a template on their systems.
So one of the things we're going to talk about next week is the fact that you start with the things you are able to do and add on as they are available. You can write an entire case with using the 3 item types that are common: multiple choice, select all that apply, and a select n. You can get that. So that's where you start. And then you add the different item types as your LMS allows you
to do.
to.
Okay, thank you so much. It was really helpful the way you broke it down into the different questions and what is needed, because I think not everybody in the faculty has heard that. And so I think it's important for those of us here who are here to spread the word that those little words like drop and close, drop and drag do make a difference for our understanding, and in turn, it'll make a difference with the student understanding. Okay. Thank you so much.
You're most welcome. And I did see a comment in the chat that the note slides are too small. So I think as I revise this, we'll try to put them as 2 slides versus 3 for handouts too.
Great.
To make it a little bigger.
Thank you. Thank you so much, Dr. Hensel. We appreciate it. Looking forward to the next workshops. A lot of stuff to absorb and comprehend. So thank you very, very much.
You are most welcome. Thank you, everyone, and have a great day.